Welcome to a Let's Talk Parkinson's event from the Parkinson's Community, Los Angeles. Today we are learning about occupational therapy for Parkinson's. My name is Judy Yaris, and I serve as Vice President for PCLA's Board of Directors. For those of you who don't know us, we are a Los Angeles-based nonprofit that provides support, resources, and community for families living with Parkinson's. I'd like to thank our sponsors for the Let's Talk Parkinson's series: Abbott, AbbVie, Boston Scientific, and Medtronic. Free programs like this are also made possible by donations from the community. If you appreciate free programs like this one, please consider making a donation on our website at www.pcla.org. I have a few quick notes for this event. We're recording today's program for our YouTube channel. You will receive a link to the recording. Please stay muted to keep your background noise at a minimum. And if you have questions, type them into the chat at any time. We will have time for Q&A at the end. And it's also my understanding that there may be some interactive Q&A during the presentation, so be prepared for that as well. Please join me in welcoming our speaker today, Dr. Malia Sacco. She is an assistant professor of clinical occupational therapy at USC. There she provides lifestyle redesign services at the USC Occupational Therapy Faculty Practice in collaboration with the USC Movement Disorder Center. She works one-on-one with her clients to develop health-promoting habits and routines. And that's all in order to improve the quality of your life and to take an active role in managing your Parkinson's. Dr. Sacco, thank you for joining us today.
Thank you so much for the introduction. I'll take it from here. So thank you so much for inviting me. I'm really happy to be here and share about OT. I am biased, but I feel like everybody, even OTs, could use OT. So please send me your questions in the chat, and I think we have a good amount of time later to do a Q&A. So I'm Malia Sacco, and I have an agenda for us today. Let's see. Will this go to the next slide? There we go. So we're going to start off with just what OT is. So I'm imagining that we have a pretty broad spectrum of understanding of OT. So there might be some people here who are like, I have no idea what OT is. And there might be people who have done OT themselves. Maybe there's some OTs in the audience too. But I also want to share what it's like to kind of get inside an OT's brain, because I do feel like that is a really good way to figure out, do I need OT? Could I benefit from OT? And then we'll learn about some like practical strategies and treatments that you might find in OT for Parkinson's and movement disorders. And I'll refer to Parkinson's, but this really does go like across the board for movement disorders as well. And then I'll share how to get started with OT if after this talk or later on you're like, yeah, I think I could use this. And then we'll have ample time for a Q&A. So please like keep adding into the chat as needed. But as Judy mentioned, I will be asking for your feedback because I think this is a community space and I want everyone to hear from everyone. So this is from our national organization. So OTs and OT assistants help people across the lifespan to participate in the things that they want to do and need to do. So that's a key factor. It's not what we tell you to do, it's what you want to do and need to do through the therapeutic use of everyday activities. And something that I want to make explicit with my clients always is that in OT, an occupation means a meaningful activity or a meaningful activity that occupies your time. So I think back when OT started in the early 1900s, occupation meant something very different than it does now. Now we think about career and profession, but this could really be any activity in your day, in your week. So for example, let's say somebody had a stroke and they can no longer brush their teeth on their own and they would really like to do that. So brushing their teeth would be their meaningful activity. And it can expand to things like cleaning your home, making a meal or a snack, spending time with others, being out in the community, reading, engaging in your favorite hobby, using a computer. So you can see how broad it is, but an OT's job is to evaluate you and get really clear and detailed on what your meaningful occupations are. So where can you find us? We are in a lot of places. So you can find us in a hospital, outpatient clinics, community centers, workplaces and schools, and also in your home if we are invited. We won't just show up, but if you have an order for home health, that can also be helpful because we can see you interacting in your environment and your space, which we'll talk about in a second, is very important for an OT. So who do we work with? As I mentioned, it's throughout the lifespan. So we might work with preemie babies in the NICU all the way through end of life palliative care and everything in between. And what approach do we take? So we're kind of getting into this, like, how does an OT brain think and see the world and see people? So we take a very holistic and comprehensive approach when we meet with people, and we look at a lot of different dimensions of health and wellness. I really like this model from the Substance Abuse and Mental Health Services Administration, SAMHSA, and they've developed this really beautiful 8 dimensions of wellness to look at all of the holistic factors that make a person well and have a high quality of life. So I kind of like to have this approach in my mind when I'm meeting someone, to ask myself these questions and ask them these questions. So at this point, I'm going to ask us to add into the chat. I'm going to see if I can open it up separately here. And I want to ask if, as you go through these different dimensions, is there one that tends to be more challenging for you to access, to manage, to upkeep? And are there certain dimensions that you find come to you with more ease? It's just a little bit easier to upkeep. And please feel free to add into the chat whatever thoughts come up for you. And one example that I think we can all maybe resonate with is social, right? So the past 2 years have been very different socially. Okay, so it looks like we have physical and intellectual. So physical tends to be harder, but intellectual is a little bit easier. It looks like we have another person sharing that physical activity is a challenge. Let's see. Yeah, so it really looks like there's a wide spread of what comes a little bit easier and what is a little bit more difficult. And I really do encourage people, as we're going through this presentation, I'd like us to apply both a strengths-based approach of like, okay, how can I utilize these aspects that come easily to me? But also, like, can we take away any strategies to help us boost up the part that's a little bit more challenging? And we can definitely like dig into this, and I'd love to hear from everybody in the chat too, your takeaways. And I do see a lot of like physical aspect there. So we will touch on that. Thank you everyone for sharing, and feel free to keep adding if you want to. So there's many different frameworks and models that OTs learn in OT school and that they use in practice. I really like the PEO model because it makes it really clear for me as an OT what to pay attention to, and also to share with non-OTs what we're looking at. So it's the person, environment, occupation model. And right here in this intersection is occupational performance. So depending on factors within the person, which might be your symptoms, it might be your strengths, it might be your values, your personality, factors within the occupation. So again, not your career necessarily, but a meaningful activity, as well as factors within your environment. So that could be literally the room around you. It could be the utensils that you're using. It could be the sensory aspect. Is it loud? Is it quiet? Is it hot? Is it cold? So it can really be broad. So when we're looking at, okay, what are we going to jump into? I always want to look at the supports that exist within each of these facets. I want to look at the challenges, because then that can inform our question of how are we going to modify, simplify, or eliminate if we find that it's really not all that meaningful in the first place. So we're going to go into a little bit more detail about examples of occupations. So I think that we probably have a good idea after I shared some examples earlier, but I do want to use this as an activity to reflect on our own occupational performance. So these symptoms are pulled straight from the Parkinson's Foundation. And I have the non-motor symptoms on the next slide, but I want us to all identify at least one symptom that tends to give us the most challenge, the one that tends to be the most bothersome, or maybe one that you are feeling most ready to address and change. So as you glance over this, we might pick a motor symptom. Excuse me. We can always go back to the slide, but I'm going to switch over to non-motor. Okay, so micrographia, freezing, tremor, balance, manual dexterity, so that like fine motor, but also like gross motor dexterity too. How about non-motor symptoms? Cramping, yes, cramping gets in the way of occupation for sure. The facial masking, shuffling gait. So the training question, I'm going to pin that one for the Q&A, but that's a great question, Robert. Okay, so cognition, sleep disorders. Yes, that is one that I hear pretty frequently, almost across the board in some capacity. Cog. Yeah, okay. So let's all take this like 1 or 2 symptoms that we've identified to focus on, because we're going to use this as an activity to apply to occupational performance. Yeah, all of these, fatigue, sleep disorder. Thank you so much for sharing. So as I mentioned, hold on to that symptom. And as we go through these examples of occupation, I would like you to ask yourself, how does this interplay with how I'm able to do this occupation? And you might find that like, doesn't really make a difference. Like I can still perform that occupation just fine to a satisfactory level. And you might find, no, that makes it very difficult, or I actually can't do that one and I need assistance for that, or I just kind of avoid it or eliminate it. And as always, I want to ask, maybe you've already tapped into your own creativity and intuition and you've come up with your own strategy. Because I think one of the benefits of these spaces is not that I just talk at you for a long time, but that we can all share as a community our different strategies. And you might pick one up from another attendee here today. So we're going to talk about some OT lingo. No OT is going to quiz you on this, but this is just so you can know what OTs do and how we think. So our first category of occupation is activities of daily living, ADLs. So these are activities that are required for us to care for our own self, our own body. And these are very concrete, as you can see. We'll talk about the other things like stress and sleep, but these are factors that are necessary for caring for our physical body, right? So for bathing and showering, does fatigue impact that? Is it fine motor and opening the slippery shampoo bottles? Is it cog? Sometimes you're like, wait, what sequence did I just do? Do I usually wash my hair first or my body first? Oh, I think we can draw on this. That's kind of cool. I don't know if you can all see that too. But I want you to take that symptom that you identified and ask yourself those questions. Is it challenging? Have I already done something to adapt, modify, simplify, eliminate? We're going to move on to the next category, which is instrumental activities of daily living. So these are not, from a very objective standpoint, necessary to take care of our physical body, but these are activities that help to support our daily participation in home and in the community. So taking care of others, whether that is caregiving role, a kid, pets, or just spouses, partners, friends, taking care of others. And communication management means something a little different to OTs. We definitely talk about communication in the sense of assertive communication and advocacy, but in this IADL category, it means our devices that help us communicate, which is something that I hear almost across the board from my clients with Parkinson's. So these are things like typing, texting, handwriting, using a computer, using an augmentative voice device. So this is really like literally what methods do we use to communicate and devices? And can we do that? Driving and transportation. I will not pretend to have the knowledge of a financial advisor, but we do help to get some organization and some planning in the financial category. Taking care of our home, cleaning, laundry, making a meal, even just a snack, and the ability to clean up. That's like a not so fun part, but it's a part of it. Religious and spiritual expression, staying safe. Do we have a plan if our mobility is challenging to get out of building if we needed to quickly? And do we have a plan for if we fall and we're at home alone? And shopping is when out in the community, but also even just things like a lot of my clients really like Instacart if that's within their budget. So we're going to talk about ways to adapt it. But again, how does your symptom interact? This is a really large category that I'm going to talk about, especially with my lifestyle background. It's health management. And I am assuming that there will be a lot of nods when I say that taking care of our Parkinson's and our other health conditions and just our health is a full-time job sometimes, if not all the time. And so, excuse me, that is most definitely a meaningful activity that occupies our time. Sometimes in a way that's rewarding and sometimes in a way that's really stress-inducing, like sitting on hold with your insurance, right? But it's all health management. How do we take care of our health? So these are pieces that we will go into like a good amount of more depth, but I want you to scan over this and just see how might my symptoms interact with this. And everything overlaps and everything is intertwined, right? For symptom and condition management, sometimes managing our symptoms takes a whole occupation to manage it, right? Or being able to take our meds and opening the bottles is difficult, or remembering to take it on time. If we got an increase in our carbidopa levodopa, remembering to make that happen, right? And we'll talk about physical activity. I'm sure all of you have heard 50 or more times how important physical activity is for Parkinson's. So again, all activities that take up our time and are potentially meaningful. These are categories that I often get a confused look, or people are just surprised that OTs see sleep as an activity. So we often think of like active, like physically active, but to an OT, sleep is something that is pretty meaningful that occupies our time, right? It allows us to show up for other occupations. And I really wanna, on this slide, highlight sleep preparation. So we prepare for plenty of other activities, right? We prepare for meal prep. We prepare to go out in the community to go grocery shopping. We prepare in the morning to get dressed, right? But we don't think about preparing for sleep as often. So this is a big topic area that I talk about with my clients for winding down our nervous system, especially when we are having those like vivid nightmares or hallucinations, sometimes like restless leg or a tremor or cramping or spasms are keeping us up. So from a lifestyle perspective, what we want to do are things that really wind down our nervous system from many different perspectives, whether it's stress management and relaxation, whether it is making sure that we're not eating right before bed. Maybe we're changing the lighting or the scent or the sound in our room, in our space, right? And we'll talk about rest a little bit later. And these are really large occupations that we could probably talk about for another 3 hours, but here they are quickly. So productivity, which could be education, volunteering, work. I do see a lot of the other things like home management and health management as productivity as well. But these are more classically known as productivity. Play, leisure, and social participation. So again, thinking about those 8 dimensions of wellness, play and social time are important to our overall well-being. So I want to ask again, looking at these questions, if anybody wants to share which symptom you use to apply these concepts to, what occupation, and are you doing something already to help? And, you know, we could, maybe if people want to unmute, we can like use a few minutes right now to just explain it in more depth. So feel free to chat or unmute. Okay. Yeah, Robert added a really great one, how to manage transportation when I can no longer drive. That's a huge piece. And that's, I think, why OTs think of not just driving, but just transportation in general. Like, how can I get myself from place to place? I notice looking at these other pieces from earlier, the shuffling gait, the masking, cognition, fatigue, sleep disorder, mobility, dressing. Any of you want to share how those interact, how the symptom and the occupation interact? Yeah, that I would love to hear from James in more depth. So James is a PT and he puts his clients in a walking program to help with cognition. Cognition is not just memory tools, it is also very much lifestyle. Like, are we exercising? Are we eating and staying hydrated? Okay, tremor is affecting eating and also swallowing, definitely. Okay, yeah, that is a really great strategy to adapt. So it looks like Robert created a padded cubby to sleep in to help with the different sleep disorders and maybe movements that are happening. And wearing gloves to prevent injury. I'm a big fan of prevention, so anytime we can do prevention rather than reaction to an injury, better. And these are questions to chew on and take away with you. We applied it to one symptom and maybe one or two occupations, but I would love to hear from people at the end too, if you'd like to discuss more what you noticed. And James has some tips about nutrition as well in the chat. Thank you. Okay. So, oh, great. Multiple alarms for pill taking. Yes, there can never be enough alarms or even identifying phone apps or other forms of accountability. And yeah, tremor and hands while typing. I'd be happy to share some more concrete strategies for communication devices. I know that's one that can be very frustrating when we can't get an email out or a text out. Okay, thank you, everyone. We will have more time to discuss too. So if you didn't get to share, you can. So we're going to discuss some areas that OTs can help in. And I wanted to fit in more concrete strategies and things for you to take home, but I think that could easily be like an 8-hour day together. So I will add the like general topics, but if there's one that you're really holding on to, please bring it up in the chat because I would be happy to share like more specific concrete strategies. But I want to be mindful of our time. So I'm just sharing some of the aspects that OT can address to improve our occupational participation and satisfaction. I just saw Howard mention StudyMouse. I love StudyMouse. It's a great software program. I don't know if it's still free, but it's a good one for tremor. So some common types of OT treatment are physical rehabilitation, so movement-oriented intervention. So a lot of these we overlap with our PT counterparts, and I'm a big fan of interdisciplinary teamwork. And so depending on insurance and what allows it, you might benefit from a co-treat with a PT and OT leading you through LSVT Big if they can coordinate their care together, or Parkinson's Wellness Recovery. Or perhaps you go to PT or OT with a specific like perspective that you're wanting with those approaches. It's a really broad category, but those are just some examples of like structured programs. Hand therapy, so strengthening, stretching, dealing with hand cramping, hand weakness. I think there was a question that was submitted during registration about OTs can help with hand and arm weakness, and that is a definite yes. That is definitely within OT's wheelhouse. OTs can also do home evaluations and then also give you recommendations after noticing points of improvement. We can be a part of palliative care, which doesn't always mean end of life care. It might just mean therapy intervention that's focused on comfort. Cognitive rehab, vision rehab, driving rehab, and lifestyle and behavioral treatment. And so my experience comes mostly in the lifestyle behavioral treatment and some of the physical rehab, but know that OTs are specialized in each of these areas. So it takes some digging, but they're there. I have some really great colleagues at a different center, maybe like half an hour away from us, who have a really robust driving rehab program. So they're somewhere in your community. It just takes digging. So as I mentioned, I'm going to focus on the lifestyle and behavioral aspects. So my clinic specifically delivers lifestyle redesign, which started at USC in the 90s. And to sum it up, it is the process of acquiring health promoting habits and routines in daily life. So a big piece of this are the habits and routines. It's not just about telling you what you should do, but figuring out how can we actually make this a habit and a routine for you, something that's sustainable beyond discharge. And it started as a well elderly study. So back in the 90s, it was specifically to look at how to boost vitality and mood and wellness in just general elderly aging population. Since then, though, there have been many, many thorough applications to chronic and progressive condition management. So at my clinic, we have a lifestyle redesign program for Parkinson's, movement disorders, for pain, for migraine headache, for post-concussion. So we really just saw the benefit of health promoting habits and routines for health management in general, for anyone with any condition. So this isn't a really pretty slide, but I wanted to just get all this out here for all of you. So for functional mobility ADLs, I'm going to kind of toggle between occupations and general topic areas for treatments. So part of it might be just body mechanic and ergonomic training in general to apply to different occupations. So that might be like sit to stand while we're dressing, toileting, or maybe like getting up from the couch or the kitchen table. So it always comes back to that functional activity. Bed mobility. So how are we getting into bed and out of bed and moving around in bed? Which is sometimes a kind of funny question, right? Like, how do you get into bed? And it's like a head scratcher, like I'll have to see and let you know, right? So bed mobility for safety and also just for comfort. Car transfers. And additionally, different interventions for falls and safety. So we can keep up our endurance and our strength and our flexibility, our dexterity for falls prevention. We can also do falls prevention from like an environmental behavioral perspective too. How's the lighting in our home? Do we have clutter everywhere? Are there rugs where the lip can be tripped on? Do I have grab bars where I need grab bars? And not just where I need grab bars because I fell here, but prevention as well, right? We might integrate durable medical equipment. On the next slide, I have some of my favorites that I like to show people. A big problem, especially when we're new to using a cane or a walker, is just forgetting to use it. And so we might talk about cognitive strategies to make sure that you are integrating it. And we'll also discuss safety and emergency planning. If we should have a fall or if we are having trouble transferring, what can we do? So this is just some examples of like durable medical equipment or adaptive equipment that we can use for mobility. So I really like this one. There's a model that has legs that go to the floor, but I do find that can be a trip hazard. So this one just fits into your couch cushions, and it can help with those like deeper couches and deeper armchairs to have more points of contact to push up with more leverage. That's kind of a similar reason for the toilet riser and the toilet grab bars. These devices down here, this picture comes from the Pleasure Able manual. And it's a really wonderful resource if anybody wants to learn more about sex and intimacy. These are just some examples that they have here for different like support pillows for comfort and for mobility and just ease. This is the handy bar. This one takes practice. Some of my clients love it and some we just decide to leave it, but it basically gives you another point of contact in that D-ring for your car opening, so that you can push off of something rather than grabbing onto the car, which can sometimes end in smashed knuckles or a fall. So the handy bar is a great one too. Like I mentioned, we might talk about getting into and out of bed, and then remembering to use our walker and our cane if we do use one. Fine motor is a big topic that we talk about in OT. So some of the most common challenges that I hear for fine motor are in dressing and bathing, grooming and hygiene, shaving, putting on makeup. That tends to be a big one, putting on jewelry, communication through like the typing and keyboarding that was mentioned in the chat, making a meal for ourselves. So opening up bottles and caps and packages and chopping and dicing and moving around the kitchen and feeding ourselves with a fork, right? And also money management, like literal money handling. And I think that was another question that was entered during the registration of like, what can I do when I drop coins or credit cards, or if I need to pick them up, or just how to avoid dropping them in the first place. And I don't have a straightforward answer for that because it's really going to depend on this person's preferences. So we might consider changing to a different wallet that adds more room to dig around in there and firmly grasp it before it flies out of our hand while we're taking it out of a slide pocket, right? We might also talk about communication. Like, can we feel comfortable asking for help if we need it? Or even more tech advanced things like paying with our phone. That is a new thing that I am still trying to figure out myself. And sometimes my clients like that because it's a little bit easier to handle than like coins and cards. And same thing goes for medication handling. So those teeny tiny pills and those teeny tiny pill box openers. So as far as treatment goes, I spoke to that a little bit. Sometimes we're looking at adaptive equipment like here. So these are these foam tubings. Without going too far in depth, increasing the diameter of our utensils can help with our issues with weakness or tremor, with coordination. So sometimes my clients will add that tubing onto a pen or their razor or a spoon. This is an example of the pen again. So it just has different points of contact for stability. And sometimes my clients find that it helps with their tremor and that their writing is more legible and they're able to keep their letters bigger for longer. And this is a rocker knife. So when that like chopping movement feels awkward, we might try out a rocker knife or those ones that you can press down on a pump and it chops your food in a nice little container. So it really depends on the person, right? And my colleagues over in hand therapy can also make custom orthoses if that is appropriate, and also lead some therapeutic exercises to help with the actual rehab of fine motor. So as I mentioned for med management, I just wanted to spend a little bit more time on that because it's a big part of Parkinson's management. We might help people come up with strategies and modifications to set up their pill box, but also keep it going, right? If we use it for 1 week and we never fill it again, that's not so helpful. So we really come up with a scheduling plan to figure out when are we gonna fill this, but also remember to refill the prescription so we're not off our meds for too long, if at all. And a big one too is remembering to have your medications when you're not home. I should have a picture on here, but one of my favorite things is a pill keychain, because usually we have our keys to our car if we drive or our home. And it's this airtight little discreet container that can hold your backup meds so that you always have them on you and you don't have to go back to the car, go back home to grab them. Another piece, so some of my clients feel very comfortable advocating with their physician and healthcare providers. And some of my clients, it's something that we work on. Like if you're not happy with side effects, let's figure out how to advocate for that at your next appointment, right? Let's see. Whoop. So sleep, a really, really common challenge with Parkinson's, as we all know. We might consider looking at the routine and the habit. So what are we doing to, again, like wind down our nervous system? Can we make any environmental modifications that help us wind down? We might also look at sleep positioning for pain and restlessness. And some OTs are also trained in cognitive behavioral therapy for insomnia. So this would be if you do have like a classic diagnosis of insomnia, but there's also aspects of this intervention that can be used for anybody, even if you don't have like clinical insomnia, where we really get to retrain your body so you're spending more time asleep in bed. It sounds magical, but I can tell you it's a pretty grueling process, and we're usually hated for a couple of weeks of that, but it can be pretty effective. Fatigue and energy management. So there is mixed research for Parkinson's and movement disorders. Some perspectives are that rest and energy conservation are very important. Some perspectives are actually that resting more and energy conservation is actually not as helpful for people with Parkinson's. It's more so the activity pacing and engaging and participating, but breaking it up a little bit. So this is something that I find is really just dependent on the person, and we see what works best for them. For some of my clients, it's really important for us to identify forms of intentional rest. And a lot of the times, rest can be a head scratcher. One of our founders of OT back in the early 1900s believed in the big four. So it's work, play, rest, and sleep. So we know what work looks like, whether that is literally clocking in somewhere, or if it is cleaning our home, managing our health. We know what play looks like. That might look like socializing and being out in the community, playing a game. We know what sleep is. We might have challenges with it, but we know what it looks like and maybe what to do to help it. But rest, when I ask people, what do you do to restore? What fills your cup? What charges your battery? It's a little bit harder, right? It might be like, oh, I take a nap. Okay, well, to me, that's sleep. So what do we do to rest? And it might be that, oh, I watch a show, or I zone out on my phone a little bit, or I browse the internet. And speaking from experience, I typically don't feel super rested and fantastic when I'm finally like getting out of my hunched position from being on the internet for too long, right? I don't know if that is truly restorative. It might be, right? But I think some of the work might be finding like, what are the activities that really fill you? And it might be quiet solitude. It might be walking around in a busy neighborhood and just enjoying the sensory experience, right? It's very different depending on the person. I mentioned activity pacing. So if it's interesting to people, we can go into the Pomodoro technique in the Q&A, but this is one strategy in tandem with a timer to help break up activities so we're not overexerting and pooping out and paying for it later. Some other approaches that can help with fatigue is practicing planning ahead. And if you're doing that already, maybe we're modifying how we do that in OT. And avoiding multitasking, which is not a real thing. Our brain is just rapidly switching back and forth between tasks, which sounds exhausting to me. So that's one way that we can save a little bit of cognitive energy. I think I saw some questions about cognition in the chat, so we'll go into more depth with this. But cognition it just looks so different depending on the person and what their challenges are. There is cognitive rehab. So there are OTs that specialize in rehab. There's also compensatory strategies and adaptive strategies that I tend to use with clients. But I appreciate what our PT in the chat mentioned of the importance of physical activity. So this last bullet point of addressing other lifestyle factors that impact cognition, this is a huge piece, right? We can do cognitive rehab, we can do compensatory strategies, but if we're not sleeping well, if we're not exercising, if we're highly stressed, if we're not staying hydrated, if our blood sugar is low, we will not be thinking clearly, right? So lifestyle is, it doesn't feel as direct and quick, but it is so important for brain health. So pretty much all the topics that I've mentioned, important for cognition, indirectly or directly. Stress management. So some of my clients notice a relationship between their symptom presentation and stress. And it doesn't need to be high levels of stress. It might just be the stress of like, oh man, I'm at this social event and my tremor's acting up. And it's this cycle. Our stress goes up, our symptom presentation goes up, or our symptom presentation goes up, so it causes stress. So I find that stress management is helpful in that regard, but also for that nervous system regulation, that overall nervous system regulation. This might also be to address just the stress and anxieties and sometimes depression and mood changes that happen with Parkinson's, inherent to the disease, but also just part of processing living with a chronic and progressive condition. So I will not pretend to have the knowledge of my psychologist counterparts, but what OT can do is figure out, how are we going to actually integrate these relaxation techniques? You have this great toolbox. How are we going to actually make that happen? Not just when you need it for a rescue and you're feeling very stressed, but just as part of your routine. And communication too is something we can talk about more if people are interested, but feeling like we can voice our needs, request help, and advocate for ourselves is a huge part of health management. So physical activity routine. So my PT counterparts and I really like to put our heads together for this. So if I'm working with someone who's saying PT, I will be there to ask, are we doing our PT exercises? And if not, from a time management perspective, from a routine perspective, how can we make that happen? And also just like bolstering and reinforcing the importance of physical activity for brain health and for Parkinson's management. So a lot of the programs and just the physical rehabilitation uses these top 2 bullet points, these principles. So can we have high intensity, high amplitude exercises? So those big exercises, of course, while being safe. Can we also integrate novel exercises? So that's where the brain health comes in. Walking is fantastic. Don't stop doing it. Or even just like movement, like sit to stand, right? I think where some of the cognitive health can come in is when we are challenging our brain. So that's why things like boxing and salsa and dancing and Tai Chi and yoga, where we're challenging our balance, why there's so much research for that improving Parkinson's, because we're forced to try something new and to get our brain involved. It's a lot harder to like do some punches or doing some like repetitive punches versus somebody yelling out a command to you of like uppercut, jab, like right. I'm not great with boxing lingo, but you get it. It's more to keep on your toes and use your brain. And a large part too is finding the just right challenge. So making sure that we are not being too sedentary, but that we're also not overdoing it and pooping out. And for this topic, I put my head together with a nutritionist to make sure that whatever recommendations are being made in their sessions with a dietitian or with their doctor are actually being followed through. Because it's one thing to be told to eat healthier, or like, these are the foods that you should eat and here are some strategies, and the actual implementation of it and the upkeep of it. Oh, and another one really specific to Parkinson's too, if we're taking Cinemet, carbidopa, levodopa, is just watching the high protein, like right before, right after a med, so that we can make sure that it's as effective as possible. This is a huge one that I could talk about for another hour, but participating in our communities and in our circles. So specific for people who are working or going to school, classes, we might talk about creating a reasonable accommodations letter so that we can advocate together for their needs so they can thrive in that environment. We might also talk about how to utilize symptom management strategies while they're out and about and not in the comfort of their homes. And we might also talk about the stress and anxieties that can come up when maybe some symptoms are flaring up or exacerbated, and that's causing stress. So I've mentioned this aspect throughout, but this is a really huge part of the OT process. And I find that it happens throughout as a thread, but it's a really big piece of like maybe the last 1 or 2 sessions where we really talk about like, how are we gonna do this after we discharge? I'm not interested in people having just a good week or a good month. I really want to figure out how can we make this feasible with your preferences, with your routines, and keep it going. We'll also consider and integrate any comorbidities. So if someone has chronic pain, diabetes, insomnia, they're working on smoking cessation, anything, we want to integrate that so we can set realistic goals. And we also practice self-compassion. Because I think all of us are guilty of setting some pretty lofty goal and then kicking ourselves when we don't meet it, which is crazy making. But we do it all the time. And so part of this is having that self-compassion of, I'm going to give myself this general goal, and here are some alternatives of what it could look like to meet that goal. I'm a big fan of interdisciplinary care, which includes you and your caregivers. And I found this image because it kind of shows all of the colors bleeding into each other and relying on each other to pop out. The blue pops because of the red. So it's my artsy way of saying that having this comprehensive care team really helps to bring all the perspectives together. And I know I'm biased because I'm on a team like this, but I really feel that this is the gold standard of care, where you really get to get everyone on board and you have a team to support you, because it's not something you can go out alone or with just one provider. So for OT, we do need a referral from physicians. So that's something you need to request. You can do a self-referral, but that might mean out of pocket or private pay. If you have a specific clinic in mind, you can ask if they have their own referral form so you can bring it to your doctor. Our clinic has one like that. Also inquire about the mode. Do you have telehealth? Is it in person? Is it hybrid? To see what's going to be the most feasible for you. And some optional things. Record your questions after this presentation, or maybe even before, you have a really strong idea of which occupations are the most important to talk about, and write that down, because our brains sometimes forget things when we're actually in the appointment. So it's nice to have a note to yourself. And if you're having trouble finding OTs near you, there are databases on things like PWR and LSVT Big, but it might be on other websites too. I know that there is an LGBTQ plus ally medical group where they have a database of people, and you can also search their specialties like Parkinson's. You might check out nearby large hospitals or academic medical centers, because quite often they have an interdisciplinary care team already established. And because of telehealth, that's a really beautiful thing. I work with people in San Francisco and Sacramento, in Palm Desert. So it really opens up the world if you want to work with a specific OT, but just be mindful of state-based limitations. So I can only see you if you're physically in the state of California, for example. Here are some references, some extra resources. And I want to open this up to a general Q&A, but if people want, and I know there's a lot of questions here in the chat for us to address, but if you do want to answer this question, share with the group from today's presentation, just what's been lingering on your mind, what's maybe one small thing that you want to do to increase your participation on your preferred occupation, your meaningful occupation. So thank you so much. I think we have 10 minutes for a Q&A.
Yes, thank you so much. We have time for questions now. And I think this format was amazing to have people put things in the chat like this. I loved it. There's two actually that are related here that just came in very close to each other. One from Howard Schiller and one from Robert Lavore. What about high protein and cinnamon, and how high is high protein? Gram, meal, etc. So that's a big one that we hear in a lot of the support groups.
Yeah, I am going to defer to my dietitian counterparts. Okay. As far as the grams of protein, I'm not positive. I do know that the standard that we go by at our clinic, it's probably different places, but half hour before or after your dose is what we want to try to plan for. So on the OT side of things, we might talk about how to make sure that that happens, because the day is busy. We're thinking about other things. Sometimes it's hard to remember that our dose is coming up or that we need to eat soon. So we might do some of that, like proactive planning, I guess.
Mm-hmm. Okay, and then somebody did ask early on what the pen is called and where can we order? Is that something that they can find on Amazon?
The pen that's kind of a Y shape, is that?
Yes.
Yeah, so that is called the pen again. I can add it in the chat. There's other like brands I think that make it, but I think this is the original that started in connective tissue disorder community for people with like Ehlers-Danlos and joint disorders. So this was for joint stability, but I've also found that it's kind of been grabbed by other communities too, including Parkinson's.
Okay, great. And then one about, can OT help with nerve regeneration?
So that is a great question, and I'm going to say yes. There's so many different offshoots from that, though. I mean, so neuroplasticity. I'm sure some of us, or maybe most of us, are familiar with that. But just to quickly define it, it is this idea that our brain and our nerves and our nerve connections are malleable through consistent behavior and use of strategy. So for example, if I'm used to brushing my teeth with my right hand, those nerve connections are very strong for my right side. If I try to do it with my left hand, it would be pretty janky and I might get bleeding gums. But if I continue to practice with my left hand, those will start to regenerate in a way or have stronger connections, and that will become easier. So with the like routine-based repetitive use of occupation, adaptive equipment, physical rehab, yes, like that nerve regeneration can happen. And without getting into too much detail of its central nervous system, that's not the case, but if it is peripheral nerves, so the nerves that are in our body, that is possible with PT, OT, and other care members.
Great. Let's see if we have more questions in the chat. If not, do we want to open it up? Oh, someone asked, are you aware of any new findings for targeting coat hanger pain? I'm not familiar with that.
Yeah, you know what? I'm not familiar with that either. If that person wants to unmute and share, add in the chat, I would love to hear about that.
Hi, can you hear me?
Yes.
Okay, thanks for taking my question. Yeah, I do find that when I talk to my fellow Parkies, that they're really unfamiliar with that term, coat hanger pain, but for the reason it's called coat hanger pain is because it occurs up in here, your upper back, and spreads out to your shoulders.
Mm-hmm.
Real thing, and it generally affects me when I'm either walking up an incline or just noodling around the kitchen preparing a meal, and I'm on my feet, and I think it has to do with low blood pressure, and getting the blood going all the way up to the brain, and so that it causes that pain, like I say. And I do find that people are not really aware of it, but I'd like to carry a banner, a little sign, and walk around saying it's a real thing.
Yeah, yeah, you're definitely an advocate for it because I did not know and now I'm aware, so thank you. Yeah, I mean, the fact that it is tied to specific activities does make me wonder about like the autonomic, like blood pressure, positioning aspect of it. So, that might be working with your PT and OT and personal trainer if you have one to just identify adapted ways to do that. It might mean activity pacing. So maybe we're used to like going for like a 30-minute walk, let's say.
That's right.
And so we might decide to stop 10 minutes in, 15 minutes in,
right,
just drink some water and like let our nervous system kind of regulate again, do it
right, bend over at the waist and let the do what you do to.
Exactly, yeah. And pain management in general, it's a whole nother topic, but it's a lot of these interventions of nervous system regulation. I always sound like a broken record, but it's doing these things for sleep, stress, eating, hydration, physical activity to help keep our nervous system regulated.
Right, thank you.
Yeah, thank you for sharing, Brian.
And if someone else would like to unmute and ask a question, if it's hard for you to type into the chat, we can take it. Do we have anyone?
Yes.
Hi.
Hello.
Will this presentation be available or posted online for review?
Yes, we will have it in our YouTube area. So everything goes on to YouTube, and you'll get a link for that at the end of the presentation.
Great, thank you.
You're welcome.
And I do see that there's some other questions too.
This came in.
James asked if paraffin wax therapy is included in hand therapy. Yes, if that's deemed to be appropriate for whatever you're coming to OT for, it can be. And just like physical modalities in general. Let's see. And please unmute and interrupt me if you have a question. I'm just going through the chat.
Okay. Let's see.
And yes, I agree, James. Family member as part of the health team. I think I bring family into the caregiver example that I had on the health team. But yes, like the whole family as well.
Can you address this question from Jane King? Is it correct that using right arm strengthens a weakness, causing it not to activate using it? I'm not exactly sure where this is, but where it's going. But let's say, is it correct that using right arm strengthens?
I'm not positive, Jane. I don't know if you're on, if you'd like to unmute, and if not, that's okay. I wonder if that's in regards to the neuroplasticity example.
Yeah, that's what I was thinking. Maybe the neuroplasticity. That's where that came from.
Yeah, I'm not positive, but please elaborate in the chat or unmute if you'd like to.
Okay. There was also one, and I think this is a common one. At times, this is from Irene. At times at register, I drop my credit card. Any suggestions how to pick it up since it's so thin?
That is a great question. I wish that there was kind of like the reacher grabber bars, but with some sticky putty at the end. That would be great. Maybe I'll invent it one day and let you know. So for credit cards, that is very tricky. One strategy I can offer is using another card to lift it up. So with one hand stabilizing the credit card on the floor and the other scooping it to get an edge up or a lip up. If you have nails, that can be helpful too, but if not, another card or a piece of paper can help to do that as well. Because that's the hardest part, is just finding a corner or a lip to grab in the first place. But that's also an example where, we could explore paying on our phone if that feels secure, or find other like purses or wallets that might help you grab onto your items in an easier way. Yeah, thank you for that question.
Okay, Jane. Oh, do we have someone that just unmuted?
Jane's unmute is not working, but she said,
okay.
My right side is weak and I notice my left arm takes over. Do I allow this, or should I make the right arm carry the weight? Fantastic question. Yes. We want to keep using our affected arm, right? As long as there's no contraindications like arthritis or like repetitive strain injury. Regardless, we still want to get both sides of our body involved as much as possible. So that is something that you could definitely work on with your care team to identify like what's the just right challenge, right? I wouldn't want your right arm to be like sore and get a repetitive strain injury because we're telling you use it, use it, use it. But we might identify some specific occupations that you can kind of challenge yourself to use that right arm. But yes, please involve both sides of the body.
Thank you again, Dr. Sacco, and thank you all for joining us today. That's all the time we have. We have some great events coming up. This Sunday, we are celebrating the creativity of our community with a live poetry reading. Please join us to hear some of the talented poets who are part of our forthcoming poetry book read some of their work. This is part of our Living Artistically event. On Friday, April 29th, we will hear about recent research on the unique needs of women living with Parkinson's. On Saturday, May 7th, we're presenting a half-day education conference for the Spanish-speaking Parkinson's community. Information about these and our other upcoming events will be emailed to you. Again, today's event was brought to you by our sponsors, Abbott, AbbVie, Boston Scientific, and Medtronic. And by you. By donating to PCLA, you can join in our mission to improve the lives of the families in our community who are living with Parkinson's. PCLA is a nonprofit, and all donations are tax deductible. If you enjoyed today's program, please consider donating at PCLA.org to help us continue our work and continue to provide programs like this for free. As always, Reach out to us with questions at info@pcla.org or by phone at 310-880-3143. Thanks, everyone. Stay safe and stay well. Thank you again, Dr. Sacco.